So, talking of Googling, are you also seeing a lot of self-diagnosis, Dr. Usha? And is that good? Is that bad? What's the risk associated?
Um, there's a lot of self-diagnosis because a lot of patients walk in and say that I've come to see you because I have PCOS, or they say they have PCOS, and they've made the diagnosis. And um, some of them are, they probably landed on the right thing because it's, pretty much connecting the dots. You have irregular periods and you have some of these hair growth, acne type of things, and you're overweight. Chances are you have PCOS. Chances are. But I'm saying that the problem with the self-diagnosis is also either it can be over-diagnosis, because as Sheila said, a lot of young, especially adolescents, have polycystic ovaries on ultrasound. And 25% or so of normal girls, normal women, have polycystic ovaries on ultrasound. Overweight or obese is a common problem. Menstrual irregularities can happen for other reasons. So it's really important for the physician to go through the history, do a complete exam, do the appropriate tests, and come to the right diagnosis. And the other thing is not just overdiagnosis. You can end up with misdiagnosis, meaning patient is actually having something else. And so PCOS is also, I just want to emphasize here, is a diagnosis of exclusion. There are some really important conditions that have to be ruled out, like Cushing's syndrome or congenital adrenal hyperplasia or prolactin problems or thyroid issues. These all have to be ruled out um, before calling it as polycystic ovary syndrome. So yes, so self-diagnosis is not a good idea really for anything, and especially a condition that is probably going to impact on women throughout their lives, and they need guidance from a professional.
Right. And, you talked of the ultrasound not being, both of you talked of ultrasound not being definitive. Is there anything that is kind of a minimum requirement to, as a diagnostic test? Or no, it's just, as you said, exclusion and, clinical.
So the most recent and the most approved and accepted diagnostic criteria, what we call the ESHRE criteria or Rotterdam, says that you need to have 2 out of 3. This is for not for the teenagers you're going to talk about next month, but for the adults, 2 out of 3. Number 1 is irregular menstruation, or what we call anovulation. Number 2 is features of male hormone excess, either clinically or by blood test. And third is polycystic ovary on ultrasound.
Right.
You have 2 out of 3 to call someone as